what challenges and successes do you think you've had in your myelofibrosis journey so far, whether it's related to treatment, whether it's related to advocating for yourself, clinical trials?
It's been very successful. I'm still here 7 years later, and my health is actually much better as far as that particular disease is concerned. My hemoglobin is almost normal. My platelets are okay, but the JAK2 mutation has dropped to 3%. The fibrosis has dropped to a 0 to 1. And when I entered the study, they couldn't even get a sample because it was a dry tap in the bone marrow biopsy. So I think that's really good. The the problems that I had along the way, almost immediately after starting the study, which was a mixture of two drugs, one Jakafi, was already approved, and the other pelabresib, which was the experimental drug. I almost immediately had a significant drop in hemoglobin to the point where I needed transfusions every 3.5 to 4 weeks. And that went on for about 9 months. And then they started spreading out. And now I haven't had a transfusion in 5 years. So that's that's really nice. The other thing is that pelabresib for me causes taste loss, both ageusia and dysgeusia. So some things I lose taste entirely, and some things the taste changes to the point where I don't want to eat it. Um, I've been able to reduce the dose of pelabresib, and that's helped for a while, but the taste problems are coming back. And so every once in a while, I'll go off the drug for a couple of weeks, get my taste back, and go on from there. The other problem, of course, was travel to UCLA. At the beginning, it was every 3 weeks. And then we went to 6 weeks. And then during COVID, we were able to switch that to every 12 weeks. And I was driving down because I didn't want to get on a plane. So that was basically a 4-day turnaround. I'd go halfway down the first day, then to UCLA, and then halfway back, and then home. So those were the major challenges for me. As far as the side effects from the drug, only the taste has really been a problem.
Yeah, I think you highlight a very good point of access to clinical trials, and sometimes patients have physical or geographic limitations and the ability to be able to make that kind of 4-day trip is quite variable from patient to patient. Ned, can you tell me a little bit about how you kind of keep an eye on how you're feeling, how you're doing in between doctor's visits? How do you kind of get a sense of, am I feeling better, same, worse? Tell me a little bit about that.
Yes, well, within the trial, there's a little a phone that we use to track some of the data and how I feel. Every day, I'm supposed to put that information in, but I also have an app on my phone that I have created that that I can track everything. And when I get my blood values, I plug them in and I graph it, and I can look at 7 years of data now. And just to give you some background, I'm a chemist by training. I've run biotech companies that have done clinical trials, and I know the importance of tracking information and having as much as possible to look at. And so I keep, it's almost like an out of body experience looking at my own clinical data from the trial. And then I show this to my doctors and they say, that's great. We love to look at this. So I think it's important not to look at any one particular item, but to look at how things are happening over time. What's the trend? And when you look at the trends for my hemoglobin, for my spleen, for my allele fraction, uh, the curves are all going in the right direction. Every once in a while it pops up, but overall, it's a very nice way to look at this.
I think that's a great point to make, Ned. Trends mattering so much more than any one individual value in time by itself, because certainly there may be a little bit of variability from symptom check to symptom check, lab draw to lab draw, but really kind of seeing how things develop over several months, I think gives us a much better sense of whether we're heading in the right direction or not.
Yeah. Well, within this trial, I've actually had to have blood draws every 3 weeks for 7 years now. So I have a lot of data.